Hi guys, we're going to talk about Chapter 7. Chapter 7 talks about the nursing process and standards of care. This chapter should be a lot of review for you as far as just working through that nursing process. So we're just going to get started here. So we know the nursing process is a 6-step process that provides a framework for problem solving. The intention is to facilitate and identify appropriate, safe, culturally competent, developmentally relevant, quality care for individuals, families, groups, and people out in the community. So when we think about quality and safety for our patients, this has become an essential focus in education. These competencies describe essential features of a competent and respectful nurse. All nurses should possess the ability to provide that patient-centered care, to work in a multidisciplinary team, to employ that evidence-based practice, add quality improvement, and utilize the informatics before them. So we know that the nursing process is a framework, and these steps really, again, should be very familiar to you. This is ongoing, and each encounter with a patient or a client will involve an assessment. Assessment is that first step. Who will perform the assessment? This could be nurses, it could be physicians, psychiatrists, social workers, dietitians, or maybe even other therapists. Who is the nurse's primary source of data that they're going to collect? It's on the patient. And who could be, who are they going to obtain that data from? It could be the patient themselves, it could be from a family member, it could be from a neighbor, maybe the police, maybe from medical records or other healthcare providers. So what does this assessment look like? The first thing we're going to think about is that psychosocial history. This is going to help us assess a client's perception of their own health beliefs, about the illness, and about wellness. What does the client do to pass the time? Is there any history of substance use disorders? And also assess the stress level and their coping abilities. Maybe what are some of their strategies that they use, and what kind of support system do they have? That's all going to fall into that psychosocial history. Within that psychosocial history, nurses should look at their cultural beliefs and practices and what could potentially impact the client's care. Being aware of those beliefs and practices is really going to help alleviate any stereotypes or stigmatizing. Spiritual and religious beliefs affect patients and how they find hope, meaning, purpose, and a sense of peace. The next part of, or another part of the assessment is that mental status examination. And that's going to consist of what's their level of consciousness, what is their physical appearance, behavior, and cognitive and intellectual abilities. When we think of level of consciousness, this can be described as being alert, maybe they're lethargic, maybe they're in a stupor or comatose. Physical appearance is going to examine personal hygiene, grooming, nutritional status, clothing. When you describe appearances, nurses may use words like they are well kept, they're clean, they're dressed appropriately. Behavior is going to look at voluntary and involuntary body movements and eye contact. It could also look at their mood or their affect. Cognitive and intellectual abilities assess for orientation, memory, level of knowledge, ability to think abstractly, and their speech. So what are some assessment considerations? With children, sources of information come from parents or guardians. They should consider developmental level, and assessment of children is an ongoing process of interviewing and observing. When we think about assessments with adolescents, the concern is confidentiality with this age group. And if they say something, is their parent going to find out? So making sure that you are giving that adolescent some of that confidentiality rapport. We want to also make sure we're educating the family. That's important with this age group, especially if we need to share some of the information that the adolescent has given us, that we're letting that adolescent know that we do need to disclose other things if it is, especially if it's going to be harmful for themselves or for others. If our focus is on an older adult, we need to be careful not to stereotype this age group. We see elderly people and assume that they are physically and mentally deficient. We do know that many older adults do have those physical limitations that may increase anxiety and stress. But another consideration that we have to think about with our older adults is making sure that just because they are getting older, mental health issues is not a normal way of living. If they have anxiety and stress, that's not normal. So we do still need to look into that. Language barriers, do we need to use an interpreter or a translator? Interpreter is interpreting that spoken word. Translating is interpreting those written words. So who do we use for interpreters? We need to make sure we're using trained, staffed individuals versus that family or friends. Sometimes family and friends tend to put too much emotion or feelings, and they may leave out those important details that need to be translated. So here is our case study for this chapter. Mr. R is a patient in the early stages of Alzheimer's. He's not been doing well. He is still aware of family members, including his sister, who has moved in with him. I still have to work, she says. So the neighbor downstairs checks in on him during the day, and there is a bell so he knows if Edgar tries to leave by himself. Mr. R's sister has brought him to the clinic because she's worried about recent weight loss and some progression in his disease process. So as you begin the assessment process, Mr. R stops you and says, I don't know why you need to do an assessment. I'm just here to get my medicines adjusted. How would you respond to Mr. R? What is the purpose of a psychiatric mental health nursing assessment? So take a few minutes to think about that. So what is the purpose of a psychiatric mental health nursing assessment? We want to establish rapport. We want to build that relationship. We want to make sure we're obtaining an understanding of the current problem or the chief complaint. We want to review the physical status and obtain any baseline vital signs. We want to assess for any risk factors that might affect the safety of the patient or maybe of others. We want to make sure we are doing that mental status examination that we talked about a couple slides ago. We want to assess those psychosocial status, identify any goals for their treatment, and then make sure we're formulating a very individualized plan of care for this patient. So the second step of our nursing process and framework is analyzing. We've done our assessment. Now we want to analyze that information. So analyzing the data collected really helps determine any diagnostics, problems, or areas of focus for care and treatment. Nursing analysis statements have three components. Again, this should be reviewed for you. The problem, what is the unmet need? The etiology, what is the probable cause of that unmet need? And what is the supporting data? What are the signs and symptoms, defining characteristics? Are they, and then is it a healthcare promotion, or are they at risk for some of these signs or symptoms? So problem-focused diagnosis or analysis is an undesirable human response to a health condition. So this statement's going to have all three of those components. So an example might be the problem is anxiety, It's related to the loss of employment or financial burden. So that's the probable cause for the problem. And the evidence might be that the patient says, I can't concentrate. Maybe they're crying, maybe they're restless, maybe they have insomnia and they're not sleeping. Health promotion is an analysis statement of motivation to improve the diagnosis. So this statement's going to include the problem plus the evidence. So for example, do they have a readiness for enhanced coping? Right, we're at health promotion. We're enhancing their coping, readiness for enhanced coping, as evidenced by seeking social support and knowledge of new strategies, right? Those are the characteristics that's going to help with this problem. And then the last analysis that we can think about, or type of analysis we can think about, is risk diagnosis. This focuses on the probability of developing a problem. So this statement might include the problem and the defining characteristics. They are at risk for. So maybe our patient is at risk for self-mutilation. And what is the characteristics that gives us that problem? Maybe they have inadequate coping. Maybe they are isolating themselves. Maybe they have an unstable self-esteem, and that puts them at risk for self-mutilation. So definitely just be aware of those different types of nursing problems and how you would document those. Then the third step of our nursing process is outcomes. So when we think about outcomes and the criteria that needs to be met, they reflect the maximum level of patient health that can realistically be achieved through nursing interventions. So these are goals. We expect for the individual plan of care to be classified as a nursing outcome classification. So making sure we're using these SMART goals. And it's really an effective way to evaluate the interventions that we put forward. So then the next step is planning. This is that fourth step of that nursing process. So the planning phase provides strategies and alternatives to attain those expected outcomes that we just set for our patients. After we assess, we formulate an analysis or a problem, then we prioritize, right? Safety is always going to come first. Interventions must be safe for the patient, other patients, and the family. Interventions must be compatible with other therapies that we might have to put our patient through. And interventions should be realistic, individualized, and evidence-based. Evidence-based practice for nurses is a combination of clinical skills and use of clinically relevant research in the delivery of effective patient-centered care. When we use research, patient preferences, and sound clinical judgment, then there's optimal patient-centered nurse-patient relationship develops. And then the fifth step for this process is implementation. So that we've identified our plan, now we need to implement some interventions to meet those expected outcomes that we have set. So some basic therapeutic strategies are going to include counseling. This may include communication skills, assisting with problem solving, maybe some crisis intervention and stress management. Milieu therapy, we talked a little bit about milieu, right? That's that environment that encompasses everybody. So we want to make sure we're securing that environment. We want to include the people, the settings, the structure, and the climate. Another strategy is promotion of self-care. So this, we're going to help offer assistance with self-care tasks and maybe setting some incentives to promote that care. Psychobiological interventions is the administration of medication. We're going to provide teaching and we're going to monitor for any adverse effects. Excuse me. Cognitive and behavioral therapies is another strategy. So we may include modeling, operant conditioning, or systematic desensitization. I remember we talked about some of those when we went through our therapists. Health teaching, we're going to include coping skills, self-care activities, stress management, problem-solving skills, and really try to promote and identify those resources that can be utilized. And the last one is health promotion. We're monitoring the patient for any negative effects and integrating those therapies. Advanced practice interventions, just be aware that you won't be doing these, but you may be working under a nurse practitioner or a provider who might do some of these things. So just be aware that some of the interventions that they may choose to do are prescribed. Obviously they're going to give medications and treatments. They may do some psychotherapy or some consultations. And then the final step of the nursing process is to evaluate. We know that this is an important part of that process because evaluation is the progress towards attaining those expected outcomes. Evaluation of individuals should be systematic, ongoing, and criteria-based. And this is where changes to outcomes occur if they started to be unrealistic or identification of appropriate interventions when outcomes were not met. So then the last thing we just want to make sure we're going through is documentation. And this really could be considered the 7th step of that nursing process. Documentation is crucial through that evaluation of those outcome criteria. Includes, you may need to include any documentation if the patient is not adhering to the interventions or the plan. Remember that documentation is a legal document. We want to make sure we are accurately reflecting the patient's condition, treatment, tests, responses, and any untoward incidences. And that concludes chapter 7. If you have any questions, you can shoot me an email or we can chat about it in class. Thanks, guys.